I am back today with another video. I'm actually sitting at my desk for once to discuss a topic. It's been a long time. I'm really glad you all can't see my desk because it is a mess right now that I really need to take care of. Before I actually clean, we'll see if I clean. Before I do that, I thought I'd make this video. I had a comment on a video, I think a few days ago. I lose track of time super easy. But I had a comment basically asking if I would discuss how I decided to go on Filmora knowing the risks. One of the largest risks that Filmora can cause is cancer. And Filmora is not the only one that does that. There is a category of biologics. Remicade is included in that. I think Cimzia, a bunch of the different ones that treat IBD, cause you to have an increased risk for cancer. And the whole idea behind these medications is that they block something that everybody has. We all have something called tumor necrosis factor, and it's completely normal. It's great for causing inflammation, which is actually a good thing if your body knows how to properly do it. Inflammation helps heal. It actually does help heal, but unfortunately in people like myself with inflammatory bowel disease, or those with rheumatoid arthritis, or those with psoriasis, our bodies just have this overproduction of the tumor necrosis factor. So it starts attacking the healthy tissue that it shouldn't. That's where the anti-TNFs or the TNF blockers come in, like Filmora, like Remicade, and they kind of cut down the amount of TNF that we have, so that way our body can't start causing inflammation and breakdown in tissues where it's not supposed to. The only problem is it can do it a little bit too much, and then you have problems with fighting off infections or other bad things that your body doesn't need. So some of the major things that they tell you before you start one is, you need to get tested for hepatitis B and you need to get tested for TB, tuberculosis, to make sure that if you have been exposed, we keep an eye on it, because if you've been exposed and it's in your body but it's not active, I think that the TNF is what is keeping it not going active. Then you bring in your medication that says, okay, no more TNF, and your TB becomes active. That is my understanding of it, but I want to give the little disclaimer that please don't take this as medical advice. Please take this as a patient, and if you have any serious questions about this, please go to your doctor. But that is my understanding of this, my very base understanding of how these drugs work. And that is why I am having this insanely long cough. So that's why I was tested for tuberculosis. I've never been exposed, so I don't have that issue. And I have to get the new series of hepatitis B. For whatever reason, in the last 2 years, I've become non-immune to hepatitis B. 2 years ago, I was tested before I started work, and I was, so who knows what happened there. But it makes my body more susceptible to these things if I've been exposed. It can also make you more susceptible to colds and infections and other things like that. And that's why my body is just really trying to get rid of this cold that it can't. Like, it's taking forever. So actually having upper respiratory infections, long-lasting coughs, is kind of common when you take Filmora. Now, the big risk of taking these drugs, and it's a very unlikely risk, but it does happen, and I have known 2 people that this has happened. Sometimes these drugs can cause T-cell lymphoma. I believe that skin cancer, you have an increased risk, but I think that's common with a lot of different immunosuppressants. But particularly with the TNF blockers, you have an increased risk for T-cell lymphoma. And I believe it's more likely if you are on another drug, like in conjunction with the TNF blocker, like if you're taking methotrexate and Remicade, it becomes more likely. Or mercaptopurine and something like one of the TNF blockers. Sometimes they do that adjunct therapy because they're more effective together than just standing alone by themselves, but it increases the risk of this. And like I said, I knew a couple people, one that actually passed away from it. So it is possible, but so super unlikely. And I think that the person in the comment was just asking, how did I make that decision knowing that could be a possibility for myself? And I think that the person in the comment was just wondering, like, how could you make that decision? Like, what brought you to that point? That's kind of how I took it. It can be really scary. It can be pretty terrifying to look at the side effects of it. I guess just my own experience as a nurse dealing with these drugs, I've seen how much it actually does improve the lives of patients, how much it can like totally turn things around for them. And I was also looking at my particular case of having, you know, I do have Crohn's disease. I've had inflammation all the way up my esophagus. I've had it in my stomach. I've had it all the way through. But in more recent years, since I've had my ostomy, my inflammation has mainly been in my colon. It's always been so much more severe in my colon. And having long-term inflammation of your colon is not good either. In fact, it increases your risk for colon cancer. So that's kind of how I looked at it. I looked at it like, I'm feeling pretty miserable. I know that these drugs can help me when other things haven't. There are so many other therapies that are coming out that are newer that I'm not ready to like try just because I don't know enough about them. The things that I know the most about are things like Humira and Remicade. I looked at feeling pretty miserable, knowing something that works for a lot of people, knowing my background where other therapies haven't worked, and the fact that either way, if I don't do anything or if I do something, there's some sort of cancer risk. I'm not looking at the cancer risk. It is so unlikely, and God forbid if it does happen, I will have to manage it then. But this is, you know, I don't feel afraid. Does that make sense? I don't know if that does. But anyway, those are my thoughts on why I decided to do the Humira despite what could happen. I know what is more likely to happen, and it is happening, is that I'm feeling better, and that's more what I'm focusing on. Sometimes you have to look at like the now rather than the future. I have to deal with what's going on right now. I can't worry about what's gonna happen in, you know, 5-10 years. Let's hope nothing happens. I know a lot of people who have done really well on it for a long time with no issues, so maybe I'll be lucky, maybe not. But that's how I have to look at it. I hope you all are doing really well. Let's hope I can actually clean this office today. All right, I will see you in the next video. Bye.